Welcome everyone. My name is Haley Buckner and I'm a registered dental hygienist and a preventive care consultant supervisor for Elevate Oral Care. So with that, I am honored to introduce the three outstanding speakers that we have today for our panel discussion. First is the American Dental Hygienists Association President, Matt Crespin, whose degrees include an MPH and RDH, followed by Michelle Lee, the Executive Director of OSAP. And our moderator today is Jackie Sanders, the Chief Editor of RDH Magazine and RDH eVillage, whose degrees include an MBA and RDH. Thank you to you three for being here today. And Jackie, I'll let you take it over now.
Okay, thank you so much, Haley. And I am very honored to be on this platform with both Matt and Michelle. I've known both of them for several years, and I know that all of our inboxes and our lives have just changed drastically over the last several weeks. So I'm glad that all three of us have this opportunity to be together with you, talk to you, kind of help sift through some of the misinformation that is out there and give you resources of where you can go to find pertinent information and not just go to social media to find out what everybody is talking about. So we have a lot to cover today. Therefore, I'm going to jump right in. I'm going to lead my first question to Matt. And Matt, dental hygienists are currently dealing with a lot, from being unemployed to wanting to know what happens when they return. How is ADHA supporting dental hygienists during these challenging times?
Yeah, thanks, Jackie. And, I'm really excited to be here and connect with all of the listeners and to be on the panel with both yourself and Michelle. ADHA has really gone to work fairly quickly on this issue. But first and foremost, I have to say we're really deeply just concerned, and we really feel what everybody's going through. We're hearing from you all. We're listening to the concerns that you have, the frustrations that you're voicing, and we just want you to know that we're here for you, and we are here to support you in whatever ways we can. With that being said, our board and staff have quickly gone to work. What seems like an eternity ago, on March 16th, our board convened an emergency meeting and started to work on these issues. We quickly released two pieces of really important information. One is the COVID-19 resource site, which you can see the website there on your screen, adha.org/COVID-19. And then secondly, we opened up a dedicated email box. And I have to tell you, for the better part of 3-4 weeks now, we are receiving on a daily basis hundreds of emails from hygienists all over the country. And every one of them is different. The needs that they're asking for are unique, and therefore we are responding to every single one of these messages individually. We have a team of staff members that are on this, and myself and our president-elect, Lisa Moravec, are reading every single one of these emails, and quite frankly, they're gut-wrenching to hear some of the stories and some of the things that people are going through. And so we certainly do feel the pain that you are all going through, and we're here to support you. With that being said, we want to continue to hear from you. We have developed on our website a frequently asked questions section. As we're getting these questions, we're starting to see themes emerge of what people are wanting information on. These frequently asked questions are categorized, and you can click on them. You can see the image here on the screen. You can click on them and there's a drop down, and they stem from things like unemployment. When it comes to that issue, we're really encouraging people file for unemployment. That's first and foremost what you need to do if you've lost work because of this issue. Every state's unemployment rules and amounts and process are different, so it's a little bit of a challenge in that sense. So we're trying to provide some broad guidance there. The other thing that's on this website that I think are useful, there's two other really important pieces. One is resources from our national partners. So ADHA is working closely with partners like OSAP and ADA and ADHA and CDC and the U.S. Surgeon General's office in a variety of different ways. And so we're providing those resources housed in one place, because we know that not all of the answers you can find on any one person's website. And then lastly is some information about some advocacy work that we've been doing. And this has been really engaging for our dental hygiene community, and it's been great to see how active dental hygienists have been in this effort. The dental hygienists have really gone to work very quickly in our advocacy campaigns. One of those campaigns is focused on governors, and that was to encourage them to heed recommendations from us and others to cease elective and non-emergency care. And that reached out, almost 6,000 dental hygienists reached out to every single governor across the country. And then we had a congressional campaign that was really focused on making sure that dental hygienists weren't left out of any COVID relief packages. As healthcare workers whose jobs had to stop because of recommendations from the federal government, from organizations, and mandates from governors, we wanted to ensure that as healthcare workers, they weren't left out of those packages. And, you know, dental hygienists, they are an engaging group. We sent more than 65,000 pieces of communication to every single congressional member in the United States. And that's really in about a 48-hour period that happened. So that was amazing for us to see. We're starting to work on a new campaign that's going to focus on dental hygiene education and the impact it's having on students. And I think I'll talk a little bit about that later. But really, what I would heed advice to everybody is you know, use those resources from these national partners. Make sure that you're finding information that's not just relevant, but that's accurate and that's been vetted. We keep the CDC recommendations right at the very top of our page so that when there's updates, which there was yesterday, and we're going to talk about that, they're front and center. They're right on the top of our page. So please continue to visit that page. It's updated daily, and we will continue to push out information, and we want to continue to hear from you. So please continue to communicate with us on a regular basis.
Thank you, Matt. I know ADHA has been very, very busy the last several weeks, and I personally am thankful to know that ADHA has been involved in all of these different meetings with ADHA and with ADA, and that we have our place at the table. So I'm glad to hear that. So thank you for sharing that, Matt. Now, another resource that I have been following very closely the last several weeks is my dear friend at OSAP, Michelle Lee. So Michelle, would you make more people aware of exactly who OSAP is and what you guys do?
Yes, thank you. And thanks for
Yes.
the opportunity to be here and talk about OSAP. So for the people that don't know OSAP, OSAP stands for the Organization for Safety, Asepsis, and Prevention. And we are a membership association, much like ADHA. We've been around for 36 years, and I joined the association as executive director almost 2 years ago now. And from the beginning, I've been saying I felt like OSAP was dentistry's best kept secret. But I think through this crisis, we're not going to be a secret anymore, thank goodness. But our purpose, our sole purpose is to provide education on dental infection control and patient safety. So we collaborate with all the associations, all the national associations. I've done a lot of collaboration the past few weeks with ADHA. We collaborate with ADA, the state associations, and they have leaned on us quite a bit to provide the subject matter experts to speak for a lot of these webinars that people are listening to out there. We have been a partner with CDC for a number of years. Some of our members helped write the 2003 guidelines and the summary in 2016. So we do have those subject matter experts. So we're happy to be here and to be helping to push the right and vetted messages out to our dental community.
Thank you. Last night, you mentioned CDC several times, and they are on top of all of this. For those of you who haven't been on the CDC website, you can actually go and follow peak levels in your own state. You can watch the country, you can watch personal information, and then in addition, they provide any changing guidelines that could be given to us as we move it from what I'm going to call phase 1 to phase 2, which is the recovery phase of a pandemic. And Michelle, I know some information came out yesterday that we were going to touch on briefly. For those who want more information, you can actually go on the CDC website. But Michelle, would you tell us a little bit about the emergency guidelines that were posted yesterday?
Yes. So, and I know that they announced a few weeks ago that the guidance should be to see only emergency patients, and so now the guidance has been posted. And what I will say is that I do know CDC was working on this right away to get this. Unfortunately, government takes a while before they can get everything through all the right channels to be able to post it, but it is posted now. And I also know they are already working on guidance for when we can go back to seeing routine patients. So that is being worked on right now. But some of the guidance for emergency patients, I think just some key things to point out is under engineering controls and work practices, they discuss avoiding aerosol generating procedures whenever possible, avoid the use of dental handpieces and air wetter syringes, avoid ultrasonic scalers, and really look at hand instruments only. They also talk a lot, of course, about PPE. What is the PPE that needs to be used right now? And although N95s are recommended, we all know it's tough to get N95s right now. Many dental offices have never had N95s, and they haven't even been fit tested. You need to be fit tested to wear an N95. It's not just like a surgical mask that you throw on and you're good to go. You need to make sure you have the right mask, and really you're supposed to also have a medical sign off before you can wear this. So if you do not have access to that, you're seeing emergency patients, they're recommending a surgical mask with a full face shield. So that's in our emergency guidance. And making sure that surgical mask is one that has been cleared by the FDA as a surgical mask. That's important too. I know a lot of people are out there doing, making cloth masks and so forth, but their guidance specifically seeing emergency patients, that's what you need to protect yourself. The other thing that I thought was really important to point out is the recommendation they have that after you do see an emergency patient, to contact that patient 48 hours after the visit and ask them if they are exhibiting any signs or symptoms of COVID-19. If a patient reports that they do have any signs or symptoms of COVID-19, they need to be referred to their medical provider, and then we need to, the healthcare providers need to follow the guidance that has been given if they've been exposed to COVID-19 at that point. So that's a good thing to remember, is that follow-up.
Okay, thank you. It seems like a large majority of the questions that I've been receiving, and you guys probably are as well, are about the PPE guidelines and what are we supposed to do and what are we expected to do when we come back, and what if I don't have all the stuff that I need when I come back, which leads us to a question I have for you, Matt, that pertains to right now, which I know some of us receive this, and it's more about what about the hygienists that are being asked to work in offices now that are not following federal and state recommendations? How do they handle these ethical challenges?
Yeah, it's a really a tough issue. You know, kind of building on Michelle's comments, when it comes to the CDC guidance, I think it's really important that we continue to heed those recommendations. I think it's important to know that our organization, OSAP, many of these groups that we've mentioned before have all been convened by Dr. Tim Ricks, who's the Assistant Surgeon General, and he's convening this oral health federal partner group to really bring these concerns to light and have discussions with everybody at the table. So I think, you know, it's really important as we move through this that we as a dental community are united on this. We have to focus on all of the dental team. We are a dental team, and we have to focus on all aspects of that team, and I think that's really important. When it comes to this ethical challenge, we're still hearing from dental hygienists that are working in offices that have not taken any of the recommendations seriously. And it's unfortunate. It's unfortunate because the staff is putting themselves at risk. They're putting patients at risk. They're putting the public at risk. So it's a real challenging ethical dilemma. We have been, in addition to the federal groups that we've been meeting with, we're also meeting with a lot of organizations across the country. Another organization that we're working with on this issue is the American Association of Dental Boards. We have met with their executive director and president and talked specifically about this issue. And we were excited to see that maybe about a week and a half or 2 weeks ago, they created a way that you can submit this information to them, essentially sort of registering this issue and bringing it to their attention that there's an office that's still operating and not following the guidance from the federal government or from CDC or others. And they can submit that information so that AADB can then in turn work potentially with their state boards. So, you know, that's something to keep in mind. The link to that document, it's a Google document. It can be found on our COVID-19 resource page. So we're encouraging people to continue to use that because we're still seeing this be a problem. You know, in fact, one of the other advocacy efforts that we made was about a week and a half ago, we sent a letter to about 33 governors that had not made any specific mandate around stopping elective care and non-emergency care. So we're still seeing that hasn't even happened in some states yet. And as we know, some states haven't even issued stay-at-home orders either. So, you know, it's a very complex issue, but, you know, we are encouraging dental hygienists to really follow that guidance. And I think, you know, most importantly, the new CDC guidance that has come out that Michelle just talked about is really important for those offices that remain open for providing that emergency care, which is needed. We don't want offices to completely shut down. There are dental emergencies, true emergencies that need to be addressed during this time. So.
Okay, thank you. Well, let's shift directions a little bit here. We have the handful of hygienists that are still working, but we have thousands that are at home. And I know they're at home because I hear from them all day long. They're reaching out, they're contacting us, they're wanting to know what they can do to pass the time. So we've got a lot of hygienists out there that are really being proactive. They're teaming up with their employers, with their dentists, communicating with their patients. They're catching up on CEs, watching tons of webinars and podcasts. And, you know, I don't know where they find all the time, but we've got proactive hygienists, which is one thing about hygienists I love. I've always said if a hygienist isn't accomplishing something every hour, then they feel like they're wasting their time. It just is what happens to us in clinic. So, Michelle, during this downtime, what can dental hygienists do to personally prepare for their return? I know you have a bunch of tools and options for them on your website. So would you please tell us about those?
Yes, thank you. Yeah, one of the things that OSAP did right when all of this first came out when we all started having to embrace this is our website. And Steve, if you'll go back to our other logo, just the OSAP logo, osap.org. That is our website. And we made an announcement. We opened up that website, our member-only sections of that website, to the entire dental community. So right now, you don't have to be a member of OSAP to use all of our resources. You have them. We have been developing these resources for a number of years. We have all kinds of amazing trainings. We call them toolkits on there, so that individuals can go. And I look at this as a great time to brush up on all of your infection control skills, right? Go back to the basics, to foundation, because the foundational blocks of infection control training. Look at standard precautions and be prepared for when we do go back. Yeah, we don't have all the answers yet about what that's going to look like, but we do know we're going to be following standard precautions. That's a given. And so on our website, you have access to all of this information. We also, like ADHA, we do have a link from our homepage for COVID-19 resources. And so we've been gathering, and we update it daily, all of the latest information from CDC, ADHA, ADA, FDA, EPA, OSHA, all of it, and state-specific guidance. So it's all there. The other thing that we have done is OSAP has launched this year the Dental Infection Control Certificate Program. It is the first ever certificate that you can earn in dental infection control. And it's the foundation for what's coming next, which in 21, we will be launching a certification in dental infection control, where you can actually earn the letters CDIPC, Certified Dental Infection Prevention and Control certification, to go after your name. So just some more letters for hygienists, right? Because I know hygienists love letters. I'm looking at two of you right now who have so many letters after your name. So it's a great opportunity, but the first step of that is earning the certificate. And if you go to, we partnered with DANB, the Dental Assisting National Board, and the Dell Foundation to develop both of these programs. And so we have a microsite. It's dentalinfectioncontrol.org. And if you go to that site, you can learn all about the certificate program and the what's coming in the certification program. And so the links are there. The certificate program, everything can be done online. So there are 3 parts to it. There's the first module will take an hour to complete. The second module takes 10 to 12 hours, and you don't have to do it all in one sitting. You can come back to it. And then once you finish that, there is a short assessment that you can take at the end, and you will a certificate will be emailed to you, and that you can hang in your operatory. I think it's a great thing to show your patients, especially when we all come back to the offices. You know, our patients are going to be concerned, and to see that during this time you used your time to better educate yourself and to learn all you can to protect them, I think it's a great tool to have right now. And for the month of April, we did something pretty incredible as well, because we understand that dental hygienists and dental assistants and dentists are out of work, a lot of them, a lot of people filing for unemployment. So we discounted this program 50%. So we've had some specials before where things were 20% off, but we have never done a 50% discount. So we wanted to make it, again, accessible for the dental professionals. So it's a great time to work on this, your infection control knowledge.
Yeah. You stirred a thought in me. I've talked to several hygienists who have started working with their dentists, and through that platform, communicating with their patients, telling their patients, creating a letter to send out to all your patients and telling them what the office is going to look like when you return. You know, there's probably not going to be magazines in the waiting room. They may actually ask you to take your temperature. They may have hand sanitizer sitting on the counter. But communicating with your patients that you're staying on top of things and letting them know what the differences are going to be are going to help to relax them. Because as fearful as some hygienists are to go back into the clinic, your patients are probably twice as fearful because they're not reading the same information that the hygienists are. So we have touched on the hygienists that are working now. We have touched on what the hygienists can do to be proactive, but we still have a large group still out there, Matt, that I'm going to look to you to see what we're doing for our students who have boards on hold, who are anxious. I know some of them don't even have their clinical patients yet. And there's a lot of anxiety in our student population, and our academia are going crazy trying to figure out how to pull this together for these students. So what's going on with ADHA and the students?
Yeah, this is a really another super important component of our community. I mean, Jackie, you remember being a dental hygiene student, and I don't think either one of us would ever want to go back and do that again, and certainly not in the midst of a pandemic that pops up, 8-10 weeks before the end of the school year. So you're correct. This is an issue that we have gone to work on, and I hope I want to share with everybody that's listening in our community that ADHA is really working to address this situation. Of course, this is a really complex situation. You see on the screen, there's 5 entities sort of listed there. You have dental hygiene programs, testing agencies, the licensing authorities, accrediting bodies, and the national board exam. It's important to understand that as an association, we don't have any mandated control over any one of these 5 entities. So this is why this issue gets a little complex. There's about 6,000 dental hygiene students in over 300 schools across the country this is impacting. So this is a really significant issue for us. Dental hygiene programs are, in some cases, have moved to virtual learning, but their clinics have obviously closed. CODA has gone to work on looking at the specific accreditation standards and how those can potentially be adapted. CODA met last week. This week, all of their different interest groups are meeting and bringing back recommendations, and the entire CODA is convening again next week. And they're looking at putting out some guidance, but again, that's going to take a little bit of time. The other piece that factors into this are the testing agencies. So you have clinical board exams that have been put on hold and are not administering tests. Jackie, you mentioned some people may not have found their board patient. I didn't find my board patient until about 2 weeks before the board exam. So, it's certainly stressful for students. It complicates things further when you talk about national board exams, the testing centers where students have to go and take their tests because of the level of security that's needed to administer those tests. Those testing centers are closed. So we know that some students had dates scheduled for April, they've been moved. We know some students have dates scheduled for May, those have not been moved yet. But you have that issue. And then it complicates it even further that you have 50 dental boards across the country that also have to make some adaptations for these thousands of dental hygiene students and dental students, and in some cases dental assistants that are licensed, to really address how they're going to go through that licensure process in the midst of all of these different challenging situations that have been presented with testing and accreditation and graduation. Is graduation even going to happen? So it's a really complex issue, but we are working on this. I think other agencies that we're working with on this are ADHA. I think they're an organization, being the voice of dental education. That includes dental hygiene and dental assisting. So Again, as I had said before, I think it's really important that we have to work on these issues together. We can't really segment this out and address, let's talk about what we're going to do with dental students, because the way we can handle this across the country, it really needs to be uniformly, and we need to do it in a unified way. So, we're trying to work together with some of these agencies, ADA, the Dental Assistant Association, and ADHA, and others, to really make sure that we're advocating and moving this forward. We hope to have another advocacy campaign. We're trying to figure out what that might look like, who we want to really reach out to, and what the ask is, because the ask of each of those entities is different. CODA controls the standards, the testing agencies control their end, the boards control the licensing. So we're trying to figure out what the best approach to that is, but we're certainly behind the scenes. Our staff is really on this. And with that, I want to just say, before I wrap this question up, our staff has gone to work in ways that I never could imagine. I mean, they are working harder than I've ever seen a group of people work. And not only are they working on the COVID-19 issues, but, we're dealing with a lot of other issues. We're still trying to run our association and put out information. The other slide that you've seen pop up a couple of times, that Steve, if you could maybe move to next, is about our CE Smart platform, which is, a brand new learning environment that we have launched. Now, this was planned to launch prior to even knowing about COVID-19. It was planned to launch when it launched. It just so happened that it's now a really easy vehicle for people to go online and get CE. This is available for both members and non-members. It's free for members. For non-members, there's a cost. It's $10 to $20, $10 to $30 a credit. And then there's also a CE tracker, so you can house all of your CE certificates in one place, the ones that you take there. If you've ever taken courses at our annual conference, those are already preloaded in there. And then you can also upload certificates that you're taking from other places, like today. So when you get your certificate, you can upload that right in there, and it'll keep track of things for you. So our staff has done amazing work, and I'm on the phone with them sometimes at 9, 10 o'clock at night, and with board members. So we really want to assure everybody that there's lots of moving pieces to this, and as everybody knows, the information is changing daily. So kudos to our staff team that's all working from home remotely as well, and doing a fantastic job keeping people up to date and helping us, supporting our board to help respond to some of these issues.
And Matt, I'd just like to say, I've been on the phone with some of your leaders at ADHA on the weekend, so I know I'm right there. They have been amazing. Great team there.
Yeah, they certainly have.
Yeah, I think there's just a massive amount of information. We're all going through different learning curves. We were talking earlier about webinar burnout. There is just so much going on, and trying to get the proper information and the right things out and reduce people's fears. And I think some of my most challenging questions and challenging individuals have gathered information from social media. And we know social media is an asset in so many ways, but sometimes during these challenges, it hasn't really been helpful, because there is so much, what is the word we use today, misinformation that is being put out there. So Michelle, I'm going to turn this one over to you and just ask you, how do you determine what is fact and what isn't? What are your hints and tips and tricks?
Yeah, it is. And I can get caught up in it just as much as anybody else. You get on there, and before I know it, it's midnight, and I've gone down all kinds of tunnels and reading these articles that people link, and then I go back and like, who is this? Who wrote this? And I think what we all have to do is to know there's still a lot of research that needs to be done, because there is a lot of speculation about what dentistry is going to look like when we all go back, what the new normal is, right? And I think right now we're not going to have all the answers when we start back up. We are going to probably have to make some educated educated guesses. I don't know if that's what you want to say, but before we have it all. However, if we make sure we rely on information that has been vetted from the CDC, ADHA, ADA, OSAP, then we know, because none of those entities are going to release information that's not evidence-based. And that's what we have to hold on to and rely on. That's what keeps us all safe. And it's, unfortunately, it takes a while to do this research. You can't just do it overnight.
I think that's probably one of the biggest lessons for all of us right now, is finding that element of patience and realizing that we are traveling a path that we have not traveled before in my lifetime, for sure, and I hope I don't have to travel it again. But if, you know, it's been really interesting to watch the different groups on social media rally together and support each other through jokes or Zoom calls or Zoom meetings. I got an invitation early this morning about a Zoom meeting tonight. I reached out to all of my hygiene classmates that I still stay in touch with, and we had a call on Saturday and just hung out. And I have to share a funny story, but one of my girlfriends told me she had designed her own PPE for when she returns to clinic, and she came back with a soccer mask on and a bandana. And but it's, you know, it's just finding humor during these times, with which I don't have a shortage finding, but it is also a very serious time. So I caution people on social media to be careful what you believe and listen to. And I've seen things about, my doctor says this and we're not going to do that, and just kind of be patient while we can. You know, Matt, I'm going to reach out to you because you have talked several times here about all the different things that ADHA is doing and how they're supporting the profession in all of these different meetings and these different platforms where we need to be present. And I'm just going to ask you, why now is it so important to be a member of the ADHA?
Yeah, you know, I mean, our members are our most valuable asset. We couldn't do what we do every day without those members. That's, you know, plain and simple. So it's important, and we value them. We use their input to pivot and make directional change. We use their input to develop programs. And so I think the more voices we have feeding into that, in giving us those inputs, it really helps us put out the most appropriate information in a really unified way. You know, we are the only association that has a unified voice and has that speaks on behalf of the dental hygiene profession, and that really is the voice for dental hygienists. And I think, you know, the more voices we have in singing those songs and making those asks and advocating on each of our behalfs, the better. You know, what Michelle mentioned earlier is, you know, making sure that we're supporting our members in this time of need. We made a decision several weeks ago to postpone our quarterly dues payment that was due on April 1st. We've postponed that till the end of May because we know that people are not working. So we're trying to do things for members to help show that appreciation and really help them see the value in those tangible benefits like the CE Smart platform, but all of the advocacy and the work that's going on behind the scenes, I think, is important. Additionally, our resource page, our ADHA resource page, like Michelle had mentioned, that's available for their members and non-members, is the same on our end too. We want everybody to have access to this information. So we really encourage what I like to call potential members, not non-members. We want potential members to come to our website, and we want them to get the resources and have that really important, accurate information, because, you know, Michelle, as you said, we're all seeing this stuff fly around on social media. And I think, you know, frankly, it really raises everybody's level of anxiety and in some ways scares people. I mean, patients are seeing this stuff, providers are seeing this stuff, and I think it's not really responsible for us to sort of go out on a limb and make recommendations without them going through a vetting process. So I appreciate that, Michelle, your organization is doing a great job of putting out really timely information for providers, and we're trying to do the same in concert with our national partners. So we hope that our members are seeing the value, but we certainly, our doors are open for increase in members. Anytime people are ready, we're here for you, and we're here to support you and speak in a unified way.
Very good. Well, we're wrapping up things here. I know we were going to open up for any questions if we received any, but I just wondered if you, Michelle, or you, Matt, if you had any final words of wisdom or advice or anything that you would like to share with our listeners at this time. Who would like to go first? Michelle?
I'll go. No, I just OSAP is there. We are collaborating, as Matt said. One of the things that we're doing, we have a weekly call that our Chief Dental Officer of the United States Public Health System, Tim Ricks, has put together, and we have representation from almost every national dental association on that call, along with governmental agencies as well, including the CDC. And I think it's a wonderful thing. It's one thing I've always loved about dentistry is the collaboration. And when I was given this opportunity with OSAP, I just didn't even think twice, because I knew we are one of those associations that we do want to collaborate with every association, because everybody has to think about infection control. It's part of all of our lives. And one of my first meetings was with first people I met was Ann Petrell at ADHA office in Chicago. So we are all about that collaboration, and we hope that people also coming to our website, looking at all the resources, will see the value in joining us, as well as we're usually a secondary membership for most people, because they're either part of their dental association, the Dental Hygiene Association, Dental Assisting Association, but our membership consists of not only dental clinicians, but educators, the consultants, the people that go out into your offices and train, do your OSHA trainings and your infection control trainings, as well as our corporate members, the companies that manufacture and distribute all the infection control information. They're very involved in our association as well. They're at all of the trainings. We just had our big event in Chicago in January, our boot camp event, and I loved that there were engineers from some of these manufacturing companies there to get their infection control training, because they need to know if they're developing these materials. So we have all of that, and we want to continue to serve dentistry any way that we can when it comes to creating environments where every dental visit is a safe dental visit.
Thank you, Michelle. Matt, do you have any final words?
Yeah, I think, as Michelle said, we're here to support everybody in this time. We want people to use our resources. We want people to engage in our campaigns, and we want people to, what I've been telling people is I hope everybody just kind of remains calm. I've gone to asking people, I hope you're staying safe, and I hope you're staying sane, because we're all home, some of us with kids and spouses and barking dogs and all sorts of things. So, I agree, Jackie, we have to, think about some of the positives that are coming from this. I think the connections that we're gaining with our families, or even the connections that we're reconnecting with friends in ways that we wouldn't normally connect with, because we crave that social interaction. So, we're going to get through this, and we're going to get through it together, and we're going to come out in a better place. But I think, again, we have to stick together, and we have to do it in a unified way, and we have to do it in a really evidence-based way. and I think all of that really requires some calm and some level-headed thinking. So everybody, I hope you stay safe and sane.
Safe and sane. Well, my part, I just want to tell both of you thank you for spending this time with me. But one thing that has occurred is I have never had so many articles come across my desk in my life. So I know hygienists are home writing. They're providing me some great evidence-based articles. So you can still get those articles and see them published in RDH Magazine. But because we did have so much pertinent information coming through that we wanted to share with you guys, the RDH eVillage newsletter has gone to an every Friday distribution. So the eVillage you get on Fridays, every Friday, it will be new information. It will be the newest things that we've learned, that we've found out, that your colleagues are sharing with me that I think you should know about. And if you have a burning message in your gut, just go ahead and write it down and send it to me. So I want to tell everybody thank you for listening to us. Send your questions in. I'm going to look now to see if we have any. But if you have a burning question here in the next couple of days, either send it to Matt, Michelle, or myself, because I have a feeling we might do this again several more weeks down the road when things have changed again. Haley, are you still with us?
I'm still here. Yes, thank you guys so much for a wonderful presentation and just for some great information and resources for everybody. And thank you to all the attendees for joining in. Just a couple quick reminders before we jump into some of the questions here. Again, that CE certificate will be automatically emailed out to the provided email in about 2 hours or so. And again, don't forget to check your spam folder if you're not finding it right away. And then, as Jackie even just said, we are planning several more of these live webinars over the coming weeks, leading up to our anticipated return to clinical practice. So be sure to like and follow Elevate Oral Care on both Facebook and Instagram, where you can always be up to date on when these will be available. And then also the website that you can see on the screen there, the elevateoralcare.com/elevatingcare, has a bunch of other free CE opportunities, as well as where this will be recorded and available for you in a few days as well. All right, so we're going to go ahead and jump to some questions. I'll read the question and kind of let you three decide on who's going to take over and answer the question, if that works for you guys. Some of them are specific to each of you, but for the first question here, the ADA has put out guidelines for emergency procedures. Will ADHA put out guidelines on essential hygiene procedures once we are all allowed to practice?
I guess that comes to me, right?
That's you.
You know, the guidelines that we are really leaning to, as Michelle had reiterated, is the CDC guidelines. I think, you know, first and foremost, those will be the guidelines that we will recommend people follow. You know, their update yesterday, I think, is a great refresher and a great touch on that. You know, will there be some specific pieces that we pull out specifically for hygiene? There's a potential that we would do that. But really, we would yield to those experts at CDC to make those recommendations.
Okay, great. All right, another question here is, when and how should I engage my office on steps we will take to assure patient safety, our safety, office procedures once we are all allowed to reestablish some level of patient care past the emergencies?
I think
Michelle?
I can answer that. You know, I think now is the time to start talking, that the practice can start discussing what needs to be done, and to go through standard precautions that still stands, and to really look at, are we doing everything that we're supposed to do? Are we following all of the CDC guidelines? Review them. Because, you know, one of the recommendations has been that came out early on with this was to screen for respiratory illnesses. That's already part of the guidelines. We should already be doing that. And it's one of those things that I think people just kind of got a little lax about. So so I think a good place to start is now have a weekly call, get on Zoom together. And just start going through that and discussing what can we do better. There is Again, there's some resources on our website. You can go and download. We have a newsletter that comes out, an educational newsletter that comes out every other month called Infection Control and Practice. And it's a scenario-based article. And you go through, and it's designed to read it with the team. And you can go through and read and answer the questions at the end. And I think people are really surprised when they do that exercise. Oh, we kind of forgot about that. Or how can we do this better now? So I think those are some of the suggestions I would give.
I'm going to jump in just with a little bit here. Just because I'm proactive and working as a team, I think this provides a great opportunity for the hygienist to reach out to their employer and get on a call, not only just with the dentist, but with the assistants, with the front desk, and make sure that everybody is on the same page and giving the same message to your patients. As fearful as you are, so are the patients. And as soon as your whole team is on the same page and can relay that message to those patients, I think you'll start seeing those patients comfortable coming back in. But you need to communicate that. One other thing is, if your office does not have an ICC, an infection control coordinator, this is a fantastic time to jump in and define yourself as that person and help your office also relieve their stress and their anxiety, because you do know all the guidelines and the things that are coming forward. So I know hygienists love responsibility. I know there's some of us that don't want any more, but when it comes to your patient, it's just one more thing that you could make this return easier for your patients.
Yes, and I'll just add to that, Jackie. It's in the guidelines that every office should have an infection control coordinator, and we do have a job description and the duties on the website. So anybody can go on there now and pull that up. It would be great exercise. Love that.
All right, great. Also, there's lots of really great positive comments coming in on both the OSAP certification as well as ADHA. So lots of love for both of those for you guys. Okay, another question that came in here is ADHA working with ADA and third-party insurers for reimbursement for CDT codes that will focus on care in the COVID-19 containment period, like teledentistry codes, limited oral evaluation codes, and things like that.
So I think there's been some guidance that's come out from CMS regarding reimbursement of teledentistry codes and how that plays into how care is being delivered. You know, as a professional association, we do contribute to provide testimony to, for example, the Code Maintenance Committee when issues like that come up. So we're engaged in that work already. So it's likely that as their work continues to move forward, we will continue to stay engaged in that work around better defining codes. I suppose there's potential that there will be new codes that are developed as a result of this for different services that we provide. And so we'll certainly be engaged in that work and as much as possible collaborate with others at the table as we do now. We collaborate with a variety of organizations when it comes to direct access or payment to dental hygienists from Medicaid or third-party providers. It's certainly policy that we support, and we want to make sure we're able to support hygienists in their work now and when they return to work.
All right, great. And again, nobody really has the answers to this here, but regarding the kind of right PPE supplies that we'll need, does anyone have a feel for how readily available those right protective equipment supplies will be from dental manufacturers and distributors?
You know, I don't know that anybody really has that answer. You've already said that. But what I do know that there are offices that are actually beginning to order extra face shields, scrub tops, just preparing for what they may need, you know, because we don't want to see a shortage once again. But I do know that there are offices starting to order supplies and get ready for returning back to practice. Michelle or Matt, if you have anything else.
Yeah, I know that what I'm hearing is we're starting to see activity in China, because a lot of the factories are in China as well. So they are able to produce again. So hopefully we'll start seeing some of those products coming over in the next few weeks.
All right, great.
Yeah, I think the only other thing I'll just add to that is I think, you know, the role that we play at ADHA in this, similar to Michelle's organization, is, you know, is really to help inform those decisions and that guidance that comes from CDC. You know, I think we have to acknowledge that right now there's limited information to help us make that evidence-based decision. So that information is going to likely come from input from organizations that are at that stakeholder table, and really the public and providers like all of you that are listening. So I think, again, that's why it's important for us to keep hearing from you, so that we can make sure to take your voice to those conversations, so that you get the guidance that you need, so that you feel safe and your patients feel safe, and we can make those movements forward.
All right, great. Okay, and this is going to be the last question here, but we have had quite a few questions come in regarding both the ADHA upcoming annual session and RDH under one roof. So Jackie and Matt, I'll let you guys address if there's any information about those coming up.
Matt, you want to go first, or you want me to go first?
I'll go first.
Okay.
So, you know, this question I think is ripe on people's mind. And I think, you know, as of today, right now, our meeting is scheduled to go on as planned. Are we going to put any dental hygienists, the public, in danger? No. We are going to make a decision on how to proceed using evidence. You know, we've talked a lot about collecting evidence. We as a board make our decisions using evidence-based decision making as well. So we have a board meeting upcoming in a couple of weeks, and we will get all of the information that our staff has been compiling on how to best proceed. But we certainly want people to know that we would continue to monitor this situation, and we're never going to put somebody at risk. But, you know, we know that something is going to, a decision is going to have to be made, and that will likely be very soon.
Yeah. Likewise, there is also an OSAP convention, Michelle, which I just thought of. But
Yep.
As far as under one roof, people who know me know that I am an optimist. And I counted the weeks out yesterday, and we've got 14 weeks until under one roof. So I believe that we are in the recovery phase. I don't know how many weeks that will take, but it is definitely something that not only RDH, but Endeavor is looking at weekly, because we have so many other conventions that aren't just dental. So there is a process that we have to go through whenever conventions are canceled or changed. Unfortunately, it's not just something we can make that decision over one day. There's a process that we have to go through. I've heard from quite a few of you, you know, wondering what we're doing, what's going on. As soon as I have the answer, I promise you I will let you know. But just as many of you who are wondering if we're going to cancel it, there's just as many of you reaching out to me and saying, please don't cancel, because it could be the opportunity that the hygienist needs to rally back together, to learn all the new things that we need to do, to embrace each other, to support each other, to cheer each other on, because we made it through this. But under one roof, just like ADHA, just like OSAP, is taking so many different things into consideration. We would never put you in danger. And to those who are worried about your finances, please know that we're looking at those situations as well, because I've heard quite a few calls about that. So we hear you guys. I promise you, I'm listening to every one of you. I stay awake at night trying to figure out how to keep everybody happy. I'm a dental hygienist. But as soon as I know, I will let you guys know. I promise, I promise, I promise.
Yes, yeah, and I would echo Jackie's.
Yeah.
Go ahead, Michelle.
I was just going to say, OSAP we did reschedule hours from the end of May until it's actually August 31st through September 2nd. So really the beginning of September. So we were able to move ours. Our hotel worked with us, which we're very thankful for.
Very good. And that's good for all of the listeners to know, because I've been to the OSAP convention several times, and it's you won't believe all the things that you will learn that you didn't realize you didn't know.
Well, and our keynote this year was already planned way before any of this happened, and he just happens to be an infectious disease doctor out of Weill Cornell Hospital in New York City. And his name is Matt McCarthy, Dr. Matt McCarthy. He wrote the book Superbugs, The Race to End an Epidemic. So I believe his talk is going to be more relevant than ever.
Good to know.
Yeah. Matt, did you have something else to say on that too? I know.
Nope, I'm good.
Okay. All right. Well, thank you guys for touching on all that. And thank you, Matt, Michelle, and Jackie, for just a wonderful presentation today. And again, we want to thank all the attendees for joining in as well. So again, on the screen there is our website where you can find the recording of this in a few days, as well as some of the other great CE opportunities that we've provided in the past weeks, as well as some information on our upcoming programs as well. And then you can also reach out to the phone number on the bottom of the screen there, which is our customer service, if anybody has any questions on anything. Also on our website, you can find a button to request an informative staff meeting for your office. Education on the latest oral health prevention is exactly what Elevate Oral Care does, and we can't wait to get back to what we do best in helping you all serve your patients. So thank you everybody for today for joining in, and we hope you all have a wonderful and safe day.